Hello, this is Professor Hoffman, and I'd like to give you a brief lecture on healthcare, medicine, and related topics. This will be pretty brief, and as in the past, I will give you a review highlighting what you need to know from this lecture for the exam. This material is broadly covered, although not nearly as up to date, in chapter 14 of the textbook. So, medical sociology. It's a fairly recent, well, sorry, I need to share the screen. Okay. Medical sociology is pretty recent, but it's an important part of modern sociology. It's concerned with explaining demographic differences in overall health, access to health care, how social institutions structure our attitude towards our body and the health of our body and our ability to obtain health care, our inclination to obtain health care. But a particular focus, particularly here in the age of COVID, are inequities that are connected with race, gender, and class, because they do exist. Um, Medical sociologists have also studied the medicalization of more and more parts of our life where something which might have been considered just a problem in living, for instance, becomes a medical problem that can be treated with a drug by a physician. We'll talk a little bit about that when we get to the section on mental health. Okay, general definition: health is a measure of a person's well being. Medicine refers to the social institutions that provide health care and are involved in preventing, diagnosing, and treating illnesses. As you might expect, sociologists with different theoretical orientations would approach medical sociology differently. Functionalists are one classical conception that they've contributed is the notion of the sick role. A person it can legitimately um, enact a sick role under certain circumstances. The person has a diagnosed illness, is willing to go to a physician, a professional, and accept the treatment that is offered. Typically, the individual is excused from the usual duties that they might be involved in performing, either in the household, the workplace, wherever. Also, they have to accept responsibility for the illness overall. Conflict theorists are particularly interested in inequality and access to healthcare, as and how the rates of illnesses vary by race, gender, and class, and the reasons that that might be the case. Symbolic interactionists are more interested in what they've called illness as a lived experience, how a person that is ill understands and interprets their situation, how they define it, the social construction of illnesses, and also the social construction of illnesses that are amenable to treatment by medical professionals using modern technology and pharmaceuticals. So, okay, to the next slide. Life expectancy at birth is a measure that you hear updated each year. It's the World Health Organization defines it as the average number of years that a newborn can be expected to live if current mortality rates continue to apply. So that oddly it varies from year to year. It used to be fairly 200 years ago. It was probably in the 40s at most, and that would be in a fairly developed economy. Um, I'm sorry. Okay, again, life expectancy, the average number of years that a newborn can be expected to live if current mortality rates stay the same, which they don't, of course. Mortality due to a number of factors, disease, infectious diseases, uh, bacterial infections, things like typhoid fever and dysentery, uh, have dropped considerably. We've seen life expectancy increase over time, more or less globally. Uh, that is partly due to the increasing incomes in more nations of the world, partly related due to globalization, economic globalization. It's also due to things like the campaign to convince people not to smoke cigarettes. That has undoubtedly had a major impact, although people still do. So, in the United States, right at the year 2020, the estimate for life expectancy overall for a child born this year, 78.93 years. Now, we know that women live longer than men. For a female child, 81.1 years is expected. For males, 76.3. The the U.S. life expectancy is not nearly the highest in the world. It's number 35 out of roughly 155 or 156 nations that are ranked. Um, However, we do pay more for our health care than any other nation. We'll get to in a moment. So the highest life expectancy in 2020, citizens of Hong Kong, 84.7 years. The lowest, Central African Republic, 52.8 years. All right. For whatever reason, I mean, I don't expect you're not going to need to know this stuff for the exam, but I'm just presenting the table. I found the most up-to-date table that I could find. I found some other raw numbers, but I didn't have time to really calculate and tabulate. So, leading more people die of heart disease than any other single illness or category of illnesses. About 23.1% of deaths are from heart disease in the United States in 2017. It's going to vary for 2020, as you can probably see from this little graphic over on the lower right. Cancer is second, 21.7%, and then a big drop to accidents, 5.9%, and a number of other maladies, Alzheimer's disease, which is probably going to be increasing with the aging of the baby boomer population, which is in progress. Suicide accounted for 1.64% of all deaths in the United States in 2017. Suicide rates have been increasing in the United States. I'll talk a little bit more about that in a moment. It's been reported, at least in October of 2020, looking at the situation then, it was reported that COVID-19, the coronavirus related disease, has become the third leading cause of weekly deaths if you just look by week rather than by the entire year. It probably will be the third for the entire year because there's a large gap here between accidents and cancer. It was also estimated that in October, we'd actually seen about 300,000 more deaths than we would in a typical year. In October, I don't think we'd hit 200,000 deaths. So that's another 100,000 perhaps that is related to COVID, but was not registered as such. Someone who did not seek care and died in the home. Actually, it's known there have been more of those cases. And in those cases, it's often not uh, ascertained whether or not a specific virus may have been involved. Uh, Often there are autopsies, but not in every case. Okay, so here we see the chart. Here's COVID-19, a big spike in at least 1 or 2 weeks. It was the leading cause of death, as you can see here. Heart disease is the purple, cancer is this blue. Down here you have normal influenza and pneumonia. So some COVID deaths could have been called pneumonia and registered that way and show up in the statistics that way. I'm sure you are probably tired of hearing the word pandemic. I'm sure you, as like most people, are really kind of weary of this world, this situation that we are in, and are eagerly awaiting something to change, some hope, well, the vaccine is what most people are talking about. Not everyone. There is a vocal anti-vaccination movement in the United States, and it's been around for a while now. I think in California, well, I'm not going to cite any actual circumstances, but there are parents who actively avoid vaccinating their children for the childhood diseases that had been pretty much wiped out for the most part in the United States. But measles, for instance, you can be vaccinated against that, and the cases of measles are increasing in the developed world. So anyway, nevertheless, some definitions. Epidemiologists are the people who study the distribution of specific diseases, illnesses, and discuss control measures, measure how much exists in a population. And for many illnesses, there is like a baseline number called the endemic level of the disease. For instance, the seasonal flu, the cold virus is a good one. There is an endemic level. It's not going to go away. It always has a victim to reproduce itself in, which is what viruses do. They take over the machinery of the person, the cellular machinery of the individual they've infected, to make more copies of themselves. That's pretty much all they do. There are some cases where there are some viruses that live in our bodies all the time and assist in digestion and some other things, but no need to go there in a sociology class. So, okay. Now, if there's a sudden increase in the illnesses above the baseline, it's typically called an epidemic. Typically, that's geographically restricted. It's not everywhere. An outbreak would be an example of another term to apply to a geographically limited increase in a disease. An epidemic could be fairly widespread, but outbreaks are limited. Pandemic, it's an epidemic that affects multiple countries and usually several continents. It is spread around the world, which is it's more likely to do in this era of airline travel and globalization. As we've seen, COVID traveled pretty quickly around the world. There's somewhere here, there's a link to an animation that shows its spread. Epidemics and pandemics have been important agents of social change throughout history, or at least definitely misery, and sometimes as a result of what people go through, society and social institutions are reorganized, particularly after the Black Death, so-called, in Europe, the bubonic plague and pneumonic plague as well. It may have been later. It may have killed a third of the population of Europe, but the result was one result is that you had a lot fewer workers and there was a lot more land. And so workers in some cases were able to get higher wages because there were fewer of them, and then they might be able to buy land. So you saw a redistribution of wealth take place in the wake of the Black Death, to the extent that in some countries laws were passed forbidding fixing wages at a certain pre-plague level. Okay, um, what one can call the American plagues or the Columbian Exchange of the 16th century refers to the discovery, so-called, or invasion or conquest or colonization of the Western Hemisphere by Europeans who brought diseases with them, to which they had some immunity. But the people living in the Western Hemisphere, who are variously called Native Americans, indigenous peoples, or first peoples, which I think is, I find that more sensible. Uh, they had no immunity, and 90% of the population was wiped out by the end of the century in the Western Hemisphere. In some cases, it was due to the natives being enslaved and worked to death in silver mines or plantations. But a few diseases went back to Europe, like syphilis. But for the most part, it impacted and killed most of the population of the Western Hemisphere. This is just a partial list. So there's a link with, I think, 12 of the biggest ones. All right. As we know, COVID-19 has hit different groups differently. People of color have had disproportionately high rates of not only the illness, but severe complications of the illness, leading to death in many cases. Uh, that's generally true for the poor, I think. But it's particularly, since people of color are overrepresented in the lower class, lower middle class and working class households, due to institutionalized patterns of discrimination that we've inherited from quite some time back, you see a disparity in outcomes. So the healthcare system just was not really prepared for this pandemic. Their business model has changed over the years, and they don't like to have empty beds that are not in use. So excess capacity is limited. By that I mean beds that could be taken by people who suddenly are victims of a rapidly spreading disease. That's why you saw in many cities tent hospitals, field hospitals, and it was never used. It may be yet. I reassembled. There was a mobile hospital, field hospital, whatever you want to call it, set up at here in Houston by Harris County, and it was, fortunately, there was no, the capacity of the existing hospitals were not overwhelmed, but that could, it could be different because we're now in a second wave of infections that began roughly a month ago, I would say, and it's increasing very rapidly. So here's the animation for the global spread of oh, I'm sorry, this is here we go. Yes, if it will open, and it's going to open in the other. The size of each country is an indication of the percentage of cases that are found there. Anyway, okay. Been more than 250,000 deaths in the US, around 12 million cases and growing globally, 56 million cases, 1.3 million deaths. One vaccine was just authorized for emergency use yesterday, I believe. So, but there are some logistical problems to getting that vaccine out to people, given the conditions under which it must be stored and transported. So another reflection of the underpreparedness of our healthcare system was the running out of personal protective equipment, PPE, right at the very beginning. Some have said that's due to our dependence upon production in other countries, which is probably true in the short run. A lot of that equipment comes from China, and trade with China was fairly well shut down by the COVID pandemic. It would hit China first, and in any case, as you probably know, people began to grab all of the masks and gloves they could find, as well as toilet paper and hand sanitizer. Many people bought as much as they could in order to resell it on eBay or Amazon or something like that at a huge profit, or profiteering, price gouging, it's often called. There are, and it happened in many countries, not just the United States, and the authorities are actively investigating these reports of price gouging and preparing prosecutions and carrying them out. Healthcare workers are being hit pretty hard as well. They're right on the front lines. They're vulnerable to infection, and they're seeing all the suffering and death. And so, in addition to the physical danger, there is a psychological toll that is going to stick with people for some time. Governments have responded differently. Some lock down everything pretty tight by lockdown. I mean, you close the non-essential businesses. You might have a curfew where everyone has to be inside at home after a certain period. There are curfews being put in place in Europe right now. To my knowledge, I believe there was one in El Paso recently, but the state of Texas is fighting with this health authorities in the city and county of El Paso, limiting their ability to respond to this. Our governor took a lot of heat from his conservative base when he ordered non-essential businesses closed in Texas and closed the bars, restaurants, although he did reopen them in a limited way. Too soon, actually, but he took a lot of heat from the conservative wing of the party, so he's definitely not going to order another lockdown of any sort. He has said as much. So, although masks are required in most counties in the state in public places, restaurants and bars, well, I don't know about bars. I don't know that they've opened per se, but what they've done is acquired enough food that can be sold to reclassify them as restaurants, so they can be at, I think, 75% capacity. If they sell peanuts or something along those lines, crackers, that makes them a restaurant. And it's believed that a lot of this second wave of pandemic is being spread in bars and restaurants. Here's another animation you can watch at your leisure about how the coronavirus spreads at the dinner table. So, okay. Also, most governments, including the United States, put programs in place to support their economies. kind of to put a floor underneath the damage that was being done because it was extensive. That will be covered in the next lecture, which, and it, the recorded lecture won't be up to date, but the PDF will be more up to date. So a lot of the programs in the United States anyway are going to end at the end of December. At one point there was a very generous additional unemployment benefit given to those who were unemployed, and again, politics became involved in that and is still involved. Uh, this is a very hot button issue, the issue of spending as much money as is required to support the economy. Doesn't sit well with politicians of generally one party that are concerned about long-term deficits. But sometimes, I mean, this is in the Second World War, concern about deficits had to go out the window. It was an existential threat to too many democracies around the world was posed by the rise of fascism, that is Hitler and his cronies. And we seem to survive all that deficit spending. Okay, so there have been some job gains in the U.S. since the biggest drop since back in the spring, but a lot of those weren't actual job gains. It was people going back to work, perhaps not with as many hours at a job with an employer who'd laid them off because they had to shut down. So there may be some more political impact in 2022. It's likely most American voters in the recent presidential election said that the COVID pandemic was the main issue that was directing their vote. And we know that more than likely we will have a new president in January. So, however, there may be more changes, more fallout from actions taken during the pandemic in the 2022 elections. That's when in Texas we vote for the governor, lieutenant governor, etc., the major state offices, as well as all of the legislators who haven't really had anything to say about the pandemic. Okay. The economic burden has fallen more on women than on men, partly because the jobs that have been lost in the hospitality sector, food service, hotels, and so forth, disproportionately employed women. Additionally, the schools closed, so women had to become an unpaid teacher for their children. Typically, it was the women. I mean, it could be shared. It really depends. Some of the more, I will say, use the word elite, the more affluent workers were able to work remotely and could assist in childcare and education while they were, in theory, working full-time for another employer. But most people could not do remote work and simply did not have an income unless it was from unemployment. So it's also fallen pretty heavily on the young, and they're a growing share of the hospitalized patients. Here's just some overall charts that kind of extend from, here is a chart showing the percentage of adults age 18 to 29 who are living with their parents, and you see this big spike up over 50% in June. It was going up anyway since 1960. It's been increasing. There are a lot of reasons for that. The economy being a big one, the difficulty of finding a well-paying job now compared to in the past, which will be something I'll take up in the next lecture, or you can read about it in the next PDF or listen to me on the recorded lecture that I will post. So, okay, it's hard to know exactly what the world and social institutions and processes are going to be like once we have a vaccine and begin to come out the other side of this. Many people think there's going to be a major transition. There may not be as big a transition as the more excited advocates of technological enhancement of our working lives believe, but there could be. Okay, workers, the knowledge workers, the more affluent ones who can work from anywhere, they like the idea of going to remote work even when there's no pandemic. Just make that the norm. If that were the case, then a person could live where they wanted to live and still have a job with an employer in a city, for instance. They might be able to live in an area that has lower home prices, cleaner air, cleaner water, more scenic surroundings. Um, but workers in the gig economy, the informal economy, can't really do that. They need to be in the midst of a large population, really, for that to work. Uber drivers have not had a lot of income, I don't believe, since this began. Definitely not airport travel to and from airports or concerts or many other sorts of public events where they might have been ferrying people about. Globally, it was estimated that 1.6 billion workers in that sector were suffering massive economic damage. That was reported in April. So I may have gotten a little better, but now we're going back into perhaps something worse than April, but without the restrictions. And the global supply chains were very stressed, particularly in the beginning. A lot of goods travel around the world on airliners as baggage. Um, they're not all shipped on by container ships, um, as many goods are. Some of the bigger stuff, a lot of small things traveled on planes, and flights were cut way back. There wasn't as much air travel as you know. So it took things a long time to get here. I ordered a mask on Etsy in mid-March, and I didn't notice until I'd already paid for it, but I bought it from someone in St. Petersburg, Russia. It took 4 months to get here, and that was not uncommon. The last big pandemic we went through was worse, at least so far. The Spanish flu, 1918, 1919, was coterminous with World War One. I don't know, coterminous is not the right word. Contemporaneous, rather. Caused by another virus, not the coronavirus, H1N1. It's the virus that causes something called swine flu. It's primarily spread by birds, but it's estimated around 500 million people were infected, 50 million people died. And in 1918, antibiotics had not been discovered. They're not useful on viruses, but they're useful on opportunistic infections that one can acquire if one's immune system is weakened by a viral infection. They did, begin actively quarantining the sick, and some towns in the United States actually kind of blockaded the roads in and out of their towns to prevent sick people from coming in. Now, why is it called Spanish flu? It didn't come from Spain. It actually came from the United States, from an army base in Kansas. It's called the Spanish flu because there were sedition. World War One was in progress, and most countries had laws prohibiting the reporting of bad news because the enemy might use it for propaganda purposes. Spain was neutral, so they printed the stories about this pandemic that was sweeping through Europe. It was illegal to mention it in the United States press, and there were only newspapers then. There was no other media. Radio had not been invented. So, and it probably played a role in ending, the sooner the better, World War One, because it was, in fact, it was taking soldiers out of action, and it was affecting the supply of new troops. Here is a map showing the spread, the focal points, primarily. This isn't quite accurate. I don't see Kansas on there at all. So obesity is leaving the pandemic for a while, obesity is a health problem that is increasing, really. Obesity increases your risk for other diseases like diabetes, for instance, arthritis, or at least having more weight wears down the joints and so forth faster. Heart disease, kidney disease. So the number of Americans considered obese was about 30% in the year 2000. It was 42% in 2017. And it's estimated it added in 2018, there was an extra $150 billion in health costs directly related to obesity. So I see something wrong with one of these statistics with that. Don't worry about it. You won't be asked to recite numbers. Anyway, some more obesity data. It also varies by race, ethnicity, gender, education, and class. You may read through that to see these patterns. Angus Deaton and Ann Case published a book in 2020 called Deaths of Despair and the Future of Capitalism. Overall, the life expectancy as I mentioned, in most countries of the world had been increasing, except in the United States. Now, it increased in 2020 for the first time in a long time, not by much, but it appeared, according to Deaton and Case, that the biggest reason for the actual decline, in addition to slowing the rate of increase, it was focused on one particular demographic, white people without a college degree, primarily in more rural areas, where there were very high rates of suicide, drug overdose, and liver failure caused by alcoholism. If you're interested in reading more about that, here's the details on the book. I've read most of it, but I read enough for it to make its point. But as I said, it appears that life expectancy has reversed course a bit. Now, you've heard claims that the rate of suicide and drug abuse and alcoholism has increased during the pandemic. Some researchers have said that is not the case. We'll have more comprehensive statistics down the road. The cost of healthcare in the US is the highest in the world, or at least the amount spent on healthcare is higher than that in any other country. In 2017, it was $3.5 trillion was spent on healthcare. That's 18% of the gross domestic product, which is the total value of all goods and services produced in a country. All right. So it's more than twice what you see in terms of a percentage of GDP for most of the developed nations. The bills can be high. There are surprise bills where you're billed for services you didn't expect because you went to an ER and you ended up being treated by a doctor who was not in your network, and you were billed for the full cost of that treatment. That is not uncommon. Some COVID testing facilities are typically, there are freestanding urgent care centers, took advantage of the demand for COVID testing and padded the bills with large facility fees and observation fees, and many, not, I don't know how many, but there were cases where people ended up with a bill for several $1,000s for a COVID test. So we'll have to see how those cases go. So here I actually had the 2019 life expectancy. So I gave you 2020 earlier. So you've got it twice here. I believe we were 45th in 2020, or maybe it was 35th. Anyway, so there's some disconnect between 2019 and 2020. And global life expectancies, inequities, health and income correlate. The least healthy are those with lower incomes. You also tend to see things like smoking and heavy drinking and often drug use correlated the same way, but there are other factors at play. Racism is a big one. Not only systemic and overt discrimination, but environmental racism, where poor people and people of color end up having to live, because it's the only place they can afford to live, in areas where there are more contaminants and pollutants. We see this in Houston particularly. If you go to Milby Park, if you go to Texas City near the plants, it doesn't look like River Oaks at all. So food deserts are another factor. In many parts of the city, you have to travel quite a ways to find fresh fruits and vegetables. There's a lot more junk food and stuff out of convenience stores that people may end up eating because transportation is an issue getting to another store. So that's something that people have begun to address before the pandemic. But okay, women do live longer than men, but because of that, they may have a slightly higher incidence of some of these diseases of old age, like dementia, that cluster of things that includes Alzheimer's disease and Lewy body disease. Women are more likely to get medical care. Men often, it seems to be the pattern, they will resist getting regular care and checkups to a greater extent than women will. There are many aspects of being a woman that have been medicalized and not quite monopolized by professionals, physicians, and so forth, but they're definitely they're definitely in the care loop now to a greater extent than maybe 100 years ago. It's only recently become noticed that women do have a fairly high rate of heart disease, but most of the research that's been done by medical researchers has been on men. Women were left out of the study. So there may be specific factors that in the outcome of heart disease in women that are unknown at present. That is being rectified over time, but it has been the case so far. Pharmaceuticals, extremely expensive. Half their budget, half their revenue goes for marketing, roughly. They spend more money lobbying Congress than any other industry. They're very powerful. They've managed to block several reforms. Here are some links to some stories about they're older stories. You may have heard about them in the past, but price increases of drugs. It's possible that when a drug, when its patent is expired, it may be possible to buy the drug, to buy the patent. And if you do that, then you can raise the cost of the drug as high as you want because you may be the only supplier. This often happens with drugs that are not widely prescribed. So the big pharmaceutical companies may just ignore them if there's not a huge market there. But a small player like Martin Shkreli, who is discussed somewhere here, right here, I believe. Well, I'm not sure now. Sorry, I think maybe the link is dead, but anyway, you might take a look at those links. The lack of health insurance is another factor that contributes to poor health among people of color and lower income individuals. The Affordable Care Act passed in 2010 created some healthcare marketplaces and subsidies for Americans without health insurance to purchase it on these markets. In some cases, in some states, Medicaid was expanded to cover more people. Right now, about 21 million people have health insurance through the ACA, but it's under attack. Probably it's not going to be eliminated by the Supreme Court, but they are considering a challenge to the constitutionality of the entire program. So private insurance, if you just buy it over the counter, it's very expensive. If you have a pre-existing condition, it used to be the case you could either be charged an exorbitant fee or you might be denied coverage altogether. The Affordable Care Act eliminated most of these practices related to pre-existing conditions, which is something you're being treated for at the time you apply for the policy. That immediately makes you, in the eyes of the insurers, a cost risk. They would prefer to only insure healthy people who never make claims. But okay. Despite the fact that the ACA, often called Obamacare, is out there, and it does have its flaws, and as you know, healthcare was a issue debated in the Democratic primary races, whether one should support something like Medicare for all or a modification of the ACA, of the existing system to make it better. The person likely to be our next president, Mr. Biden, was on the side of modifying, reforming the ACA system, was opposed to Medicare for all. We'll see how that goes. But still, 28 million Americans have no health insurance. Most of those are children. There is in Texas a children's health insurance program, but it is underfunded and inadequate. And Texas has more uninsured citizens than any other state. Okay.